Hello from ARV Centers. If you're watching this video, you probably have symptoms of uterine fibroids. Uterine fibroid is also called a leiomyoma or just a myoma. These are a benign type of tumor that arises from the smooth muscle tissue of the uterus. These can be found in kind of three different areas of the uterus. They can typically be found inside the uterine wall. They can also go inside the cavity of the uterus or inside the womb itself, and sometimes can actually protrude into the abdominal cavity or kind of sit on the outside of the uterus. A lot of times leiomyomas or fibroids are not even symptomatic, so just because you've been diagnosed with a fibroid doesn't necessarily mean it should be treated. Oftentimes we can do conservative treatments to treat more minor symptoms like using ibuprofen or even some prescription medications. But as women get older and they're in their mid to late years of childbearing, we tend to see that fibroid symptoms can become worse, fibroids can get larger, and the number of fibroids can increase. So fibroids can come in singles, they can come in multiple fibroids. We've seen women with fibroids upwards of 10, sometimes more. And fibroids can be small in size, like 1 centimeter. It can actually get to be the size of a grapefruit and even larger sometimes, making the woman feel pregnant. These are kind of rare cases, but fibroids come in many different shapes and sizes. So most of the symptoms that you probably have experienced with fibroids would probably be heavy bleeding, clotting, pelvic pain, maybe frequent urination and constipation. Some women with super heavy bleeding can actually become anemic and maybe even need transfusions or iron supplements to help with the anemia. We know that as these symptoms can progress and become so severe that it really inhibits the quality of life for a lot of women. And this is generally when we'll start to consider treatment options. Unfortunately, a lot of the treatment options are rather invasive, meaning it requires surgery or surgical interventions. And a lot of women just aren't in the time of their life that they can, be down for a long period of time. Either they're working or they have small children. And so surgical intervention just doesn't seem like a great solution or a great option for them, especially when we're considering hysterectomy or maybe a myomectomy, where the surgical intervention is going to require like 6 to 8 weeks of recovery. And I know that doesn't sound pleasant. So at ARV Centers, we do a minimally invasive treatment to treat these fibroids. It's been FDA approved for over 30 years. This is an in-office treatment where we actually do the treatment right here in this procedure room. It takes roughly about 45 minutes, upwards to an hour and 15 minutes to do this procedure. Again, this is a minimally invasive treatment that restricts blood flow specifically to that uterine fibroid, and then restricting the blood flow helps the fibroid to die off. So then after the fibroid dies, the symptoms obviously are greatly reduced, if not alleviated completely. These treatments are typically covered by all major insurance plans, including Blue Cross Blue Shield, Cigna, Aetna, United, Humana, Medicaid. Pretty much all of these plans are going to cover this treatment. This is an indicated treatment for fibroids. So if you're tired of suffering from fibroid symptoms and you'd like a non-surgical treatment, something that's safe, effective, FDA approved, click the link below, schedule your appointment. We'd love to see you in for a consultation. We'll review your past medical history. We'll look at what kind of imaging studies you've had, whether that be ultrasound, MRI, or maybe a CAT scan. And we'll decide from there if you'd be a good candidate for uterine fibroid embolization, or otherwise known as a UFE. Great, we look forward to seeing you in the office, and can't wait to help you with your fibroid symptoms. Take care.